Okay, now we are at part one, respiratory anatomy and physiology and assessment. The anatomy of the respiratory system provides passage for oxygen and carbon dioxide to get to the alveoli and back out to the atmosphere. Respiration is the gas exchange that happens in the alveoli, whereas ventilation is what we are mechanically doing to breathe. The upper airway extends from the mouth and nose to the larynx, nasal cavity, oral cavity, and pharynx. The larynx joins the upper and lower airways. The upper airway, as you'll notice in the anatomy, the upper airway extends from the mouth and nose to the larynx. It includes the nasal cavity, oral cavity, pharynx. The larynx joins the upper and lower airways. The nasal cavity is the most superior part of the airway. The maxillary, frontal, nasal, erythmoid, and sphenoid bones comprise the lateral and superior walls of the nasal cavity. The hard palate forms the floor of the nasal cavity. The cartilaginous and highly vascular nasal septum separates the right and left nasal cavities. Several structures connect with the nasal cavity. These include the sinuses, the eustachian tubes, and the lacrimal ducts. The sinuses are air-filled cavities that are aligned with the mucosal membrane. There are four pairs of sinuses: the erythmoid sinuses, the frontal sinuses, maxillary sinuses, and the sphenoid sinuses. They are named for the bones that they are contained within to help reduce the overall height of the head and thought to assist in heating, purifying, and moistening inhaled air. The sinuses help trap bacteria and other substances entering the nasal cavity. Because of this, they can become infected, causing sinus infections. Fractures of the upper sinuses, the sphenoids, can occasionally cause cerebrospinal fluid to leak from the cranial cavity into the nasal cavity. Clinically, this presents with clear fluid draining from the nose, or also known as rhinorrhea, and can provide a direct route for the transmission of pathogens to the brain and associated structures. The eustachian tubes or auditory tubes connect the ear with the nasal cavity and allow for equalization of pressure on each side of the tympanic membrane. Swallowing can assist in equalizing this pressure. The nasolacrimal ducts drain tears and debris from the eyes into the nasal cavity. This can cause the nose to run when somebody cries. Air enters the nasal cavity through the external nostrils. Nasal hairs just inside the external nares initially filter the incoming air. The air then proceeds into the nasal cavity where it strikes three bony projections, the superior, middle, and inferior turbinates, or conchae. The shelf-like structures, which are parallel to the nasal floor, serve as conduits into the sinuses, increase the surface area of the nasal cavity, and cause turbulent flow. This turbulence helps to filter the air by depositing airborne particles on the mucosal membrane lining the nasal cavity. Hair-like fibers called cilia propel those trapped particles to the back of the pharynx where they are swallowed. Because the mucosal membrane is covered with mucus, has a rich blood supply, it also immediately warms and humidifies the air entering the nose. By the time the air reaches the lower airway, it is at body temperature of 37 degrees Celsius, 100% humidified, and virtually free of airborne particles. Air proceeds from the nasal cavity through the internal nares into the nasopharynx. The tissue of the nasal cavity is extremely delicate and vascular. Because of this, the susceptible to trauma always remember that improper or overly aggressive placement of tubes or mechanical airways can cause significant bleeding that direct pressure might not be able to control. So we just went over the anatomy of the nasal cavity, the sinuses, the eustachian tubes, the nasolacrimal ducts. We've described how it enters the nasal cavity through the nares and proceeds into the nasopharynx. Now, as we move into the oral cavity, the cheeks, the hard and soft palates, and the tongue form the mouth or oral cavity. The lips that surround the mouth's opening are fleshy folds of skin. Behind the lips lie the gums and teeth, normally numbering in 32 in the adult. Significant force is required to avulse or dislodge or fracture the teeth. Broken or dislodged teeth can potentially obstruct an airway. The hard palate anteriorly and soft palate posteriorly form the top of the oral cavity and separate it from the nasal cavity. The tongue, a large muscle on the bottom of the oral cavity, is the most common airway obstruction. It attaches to the mandible and the hyoid bone through a series of muscles and ligaments. The U-shaped hyoid bone is located just beneath the chin. The hyoid bone is unique. It is the only bone in the axial skeleton that does not articulate with any other bone. Instead, it is suspended by the ligaments from the styloid process of the temporal bone and serves to anchor the tongue and larynx, as well as support the trachea. The pharynx is a muscular tube that extends vertically from the back of the soft palate to the superior aspect of the esophagus. It allows air to flow into and out of the respiratory tract and food and liquids to pass into the digestive system. It contains several openings, including the internal nares, the mouth, the larynx, and the esophagus. The pharynx is divided into three regions: the nasopharynx, the oropharynx, and the laryngopharynx or hypopharynx. The nasopharynx is the uppermost region, extending from the back of the nasal opening to the plane of the soft palate. The oropharynx extends from the plane of the soft palate to the hyoid bone. The adenoids, lymphatic tissue in the mouth and nose, filter the bacteria. Either hypertrophy or swelling of the adenoids from infection may make them large enough to obscure the view of the posterior pharynx. The laryngopharynx extends posteriorly from the hyoid bone to the esophagus and anteriorly to the larynx. The laryngopharynx is especially important in airway management. Because the mouth and pharynx will serve dual purposes for respiration and digestion, a number of mechanisms prevent accidental blockage. To prevent foreign material from entering the trachea and lungs, sensitive nerves activate the body's cough and swallowing mechanisms, as well as the gag reflex. Located anteriorly on the hypopharynx is the epiglottis, a leaf-shaped cartilage that prevents food from entering the respiratory tract during swallowing. Just anterior and superior to the epiglottis is the vallecula, a fold formed by the back of the tongue and the epiglottis. It is an important landmark for endotracheal intubation. A series of ligaments and muscles connect the epiglottis to the hyoid bone and mandible. Immediately behind the hypopharynx are fourth and fifth cervical vertebral bodies. The larynx is a complex structure that joins the pharynx with the trachea. Lying midline in the neck, it is attached to and lies inferior to the hyoid bone and anterior to the esophagus. It connects the thyroid and cricoid cartilages, both connected to the tracheal cartilage, or both considered tracheal cartilage, the glottic opening, the vocal cords, arytenoid cartilage, piriform fossae, and the cricothyroid membrane. The main laryngeal cartilage is the shield-shaped thyroid cartilage. Larger in males than in females, the thyroid cartilage forms the anterior prominence called the Adam's apple. The arytenoid cartilage, which forms a pyramid-shaped attachment for the vocal cords posteriorly, is an important landmark in endotracheal intubation as well. Posteriorly, smooth muscles close the gap in the thyroid cartilage directly behind the Adam's apple. The thyroid cartilage houses the glottic opening, the narrowest part of the adult trachea, which is bordered by the vocal cords. The patency of the glottic opening or glottis depends heavily on muscle tone. On either side of the glottic opening are the piriform fossae recesses that form the lateral borders of the larynx. The thyrohyoid membrane attaches the upper end of the thyroid cartilage to the hyoid bone. Within the laryngeal cavity lie the true vocal cords, white bands of cartilage that regulate the passage of air through the larynx to produce voice by contraction of the laryngeal muscles. The vocal cords can also close together to prevent foreign bodies from entering the airway. The passage of an endotracheal tube between the vocal cords interferes not only with the creation of sound, but also with the protective function of coughing. Beneath the thyroid cartilage is the cricoid cartilage, which forms the inferior border of the larynx. Often it is considered the first tracheal ring. Unlike the thyroid or other tracheal cartilages, whose posterior surfaces are open and not fused, they are C-shaped. The cricoid cartilage forms a complete ring. The esophagus lies behind the cricoid cartilage, so pressure applied in a posterior direction to the anterior carotid cartilage or cricoid is thought to occlude the esophagus, otherwise known as cricoid pressure, thus inhibiting vomiting and subsequent aspiration during airway management. In children, the cricoid cartilage is the narrowest part of the laryngeal airway. The fibrous cricothyroid membrane connects the inferior border of the thyroid cartilage with the superior aspect of the cricoid cartilage. It is the site for surgical airway techniques. A mucous membrane lines most of the larynx, rich with nerve endings from the vagus nerve. It is so sensitive that any irritation sparks a cough. For forceful exhalation of a large volume of air, first air is drawn into the respiratory passageways. Next, the glottic opening shuts tightly, trapping air within the lungs. Then the abdominal and thoracic muscles contract, pushing against the diaphragm and increasing intrathoracic pressure. The vocal cords suddenly open and a burst of air forces foreign particles out of the lungs. The laryngeal mucous membrane is so sensitive that it is stimulated by a laryngoscope or an endotracheal tube can cause bradycardia and slow the pulse rate, hypotension, low blood pressure, and decreased respiratory rate. Other structures approximate the larynx and of particular interest when you perform surgical airway procedures are the thyroid gland, carotid arteries, and jugular veins. The thyroid gland is a bow tie-shaped endocrine gland that is located in the neck. It is highly vascularized inferior to the cricoid cartilage. It contains two lobes, one on each side of the trachea. Those lobes are joined in the middle by the isthmus that extends across the trachea. The carotid arteries run closely along the trachea. Several branches of the carotid arteries cross the trachea. Likewise, the jugular veins lie very close to the trachea. Several branches of jugular veins, such as the superior thyroid vein, cross the trachea.